welcome everyone to this Lunch and Learn organised by Boost and North Cumbria Knowledge and Library Service. My name's Tracy and I'm joined today by Mark Fishpool, who's the Programme Director for You've Got This, which is a place-based whole system approach to tackling physical inactivity. So if we can move on to the next slide. These lunch and learn sessions are a space for health and care staff to come together to share any experiences, to learn something new related to health and care, and to focus on a quality improvement project or a case study, and of course to be signposted to further useful resources that could help us all. And the next slide, we just have a few protocols to go through. Please make sure you've got your webcams off, and please make sure that you're muted unless you're invited to speak at the end to ask any questions. You can use the chat option for some questions or comments, and if we've got time at the end, we'll come to those. If we don't, Mark is more than happy to answer those after the event. Please listen with respect and be present, and teach this forward, share this far and wide. We are recording, and the recording will be available on the Boost YouTube playlist after the event. So again, you can watch it again, or of course, share it with your wider networks. And so without further ado, I'll pass you over to Mark.
Right, lovely. Thanks, Tracy. And thanks very much for the invitation to come along and speak today about some of the work that we've been doing. You've Got This. What I'm going to cover in the presentation, we've got 7 years work behind us, so obviously I'm not going to do all of that in 30 minutes. I'll tell you a little bit about the background to the work that we're doing and some of the principles that we use, and then I've just got a few examples to share with you that cover different aspects of the work and kind of identify some of the key ways of working that we've been involved with. So first of all, a little bit about on the national perspective. So what is You've Got This? We're one of 12 Sport England placed partnerships across England, which are looking at innovative ways of enabling inactive people to become more active and increasing population level physical activity. The important points there are about helping inactive people become more active and taking a population level approach to tackling inactivity. Sport England asked all 12 of those place partnerships to focus on exploring new ways of working. Physical inactivity is a complex issue, so the way in which we start to address that needs to be appropriate, and I'll say a bit more about that in a moment. So the kinds of things that they've asked us to think about is taking a systems-based approach, how we value learning, collaboration and leadership throughout the system. You've Got This is funded by Sport England. We're hosted by Redcar and Cleveland Borough Council and a part of the joint Public Health South Tees service across Redcar and Cleveland and Middlesbrough. But the work that we do, and we'll come into this a little bit more as we go through the presentation, is actually delivered predominantly by our wide partnership of local organisations. And the approach that's been used in the 12 pilots is now being expanded by Sport England, working in up to further 80 places across the country. So a little bit about our approach that we're using here. The first bit is our vision, and our vision that You've Got This across our partnership is active lives as a way of life. So recognising that the greatest opportunities for increasing physical activity at population level is how we can build physical activity into aspects of people's daily lives. And we take what is termed a whole system approach. So much more than just individual changes, it's about taking action at all levels of the system. And we use this model, which is the socio-ecological model, to describe that. So traditionally, if we were looking at physical activity, we would be focusing on individual behaviour changes. And that's still really important. You know, that's still at the heart of it. If people are going to become more active, it's their behaviour that will change. But what determines that behaviour is much more than an individual's motivation and opportunities to be active. It's dependent on all these levels of the system. So when we're taking a systemic approach, we're talking about how we align all those levels of the system in place to encourage people to be more active and then to sustain activity over time. We haven't got time to go through all of that today, so the area that I'm going to focus on particularly is around how we build a value of physical activity into organisations and institutions, and we'll have some examples of that coming up. The second part of our approach is that Sport England asked to look at was to put a real value on insight and learning. So being insight-led in the work that we do, but also being honest about what does and doesn't work. And they're Sport England particularly interested in that because if we look at what doesn't work, then that's valuable learning in itself, but it also opens the door for us to start to recognise and value unexpected outcomes that come out of the work, which if we just focused on what's gone well, we might miss. And very much focused on the how and the why change is and isn't or isn't happening, rather than just what's going on, what's taking place. To give you a quick idea of that, we do quantitative measurement, and part of our programme is looking at 4 wards in detail, 2 in Middlesbrough and 2 in Redcar and Cleveland, and doing a boosted active lives survey in those areas where we're starting to see some improvements in terms of levels of inactivity. But that's very much supplemented by qualitative approaches, which enable us to really dig down deep, both in terms of understanding our place, the insight, and also understanding change using methods such as sentiment analysis and storytelling. The next part of our approach is very much around collaboration, leadership, and building a common purpose around physical activity. So it's about working together to address inactivity, using our existing relationships and building new ones, and moving away from a competitive approach to working to a more collaborative one. And as I mentioned earlier, that's very much focused on how we build a value of physical activity more widely across the system, and particularly how organisations can use physical activity to meet their own organisational objectives. One of the measures of the collaborative approach is the way in which we've used the resources from Sport England to fund the work. So the You've Got This team itself is small. There are only 5 of us, and virtually everything that we actually deliver in place is delivered by collaborations of organisations, and that's reflecting this is the percentage of funding that go to different partners. And you'll see from that the majority of our funding is going into what we would term local trusted organisations, so they're largely VCS organisations in place. Other local providers who are also trusted, but they're larger organisations like Everyone Active, our leisure provider, and also into places like the hospital. And the first example I'm going to give you is a piece of work that we've done in partnership with James Cook University Hospital in Middlesbrough. So if we move on to those examples, the first one is the PrepWell programme, which is a prehabilitation programme, and that was designed to support patients to help them to improve their fitness, health and well-being before major surgery. It was developed from work and with Professor Jerry Danjou and his team at James Cook University Hospital, and delivered by the Hospital Trust and Public Health South Tees in partnership with ourselves. The basis of the work was that inactivity, smoking and excess alcohol are all associated with adverse surgical outcomes. And in South Tees, the prevalence of those behaviours in people presenting for surgery is somewhere between 30 and 50%. So it's a significant factor. Prehab, and the programme itself is known as PrepWell, involves a coordinated lifestyle and wellbeing support package for patients in advance of the surgery to improve their preoperative physical and mental health, mental wellbeing, and then speed up recovery. One of the features of the programme is although it had a very fixed, potentially a fixed period of 6 to 8 weeks, because of the way that we delivered it with the hospital, it could be adapted to accommodate different surgical timeframes and the needs of individual patients. And also we started the work just before COVID, and that then gave us the opportunity with the hospital to develop a digital model in response to COVID as a necessity, which has then also continued. And this was an initial cohort of patients, and the impact of the prehab on their post-operative some of their post-operative outcomes. And we're particularly interested, of course, in the physical activity side. So the boxes in red at the top demonstrate the increases in aerobic exercise and strength training in people who presented for surgery. You can see that at exit, the number of patients meeting those guidelines was far higher, and particularly for aerobic exercise, it was maintained at a high level 3 months post-surgery. This is significant for us because we're obviously our aim is very much to try and sustain behaviours, and what has come out of this came out of the work was that those behaviours were sustained when people had the teachable moment of significant surgery, and there were similar patterns for most of the other behaviours as well, with the exception of smoking, where 3 months afterwards people had returned to the same behaviours. All of which demonstrates the importance of that teachable moment. And the economics of it were that at the time, the cost was about £400 a patient, reducing costs of around £800 a patient. So our learning from the programme was the importance of early intervention because it improved both the outcomes and recovery. The importance of that teachable moment to create the optimal conditions for lasting behaviour change. The importance of the collaborative approach. So this was a three-way collaboration to enhance effectiveness and sustainability, and the opportunity presented by digital and giving patients choice around the kind of prehab program they took part in, and linked to that, the not, and I'm sure most of you know this from your own work, there's no one size fits all. The flexibility of the approach to meet patient needs is important. Now, the one thing to say about this is, unfortunately, after the pilot, the programme in its full sense wasn't carried forward, although the digital offer and some other elements of prehab are still being delivered at the hospital. But PrepWell, the learning from it is now a key part of our Waiting Well programme in South Tees, where physical activity has very much been embedded in that programme. The second example I'm going to go through with you is flipping pain, and those of you who came to the session last month will have had a longer presentation on this by the team from Connect Health. But in summary, it's a programme that enables health professionals and communities to rethink their approach to tackling chronic pain, which we recognise in place from our insight is a major contributor to physical inactivity. The programme uses a science education approach to engage and empower communities to rethink pain, very much with a message of pain doesn't always mean harm. And locally, it was delivered by ourselves with Tees Valley Sport, Teesside University and the ICB alongside Connect Health. And again, the added value of the resources that we brought in from Sport England was very much to create that programme and develop it in a local context. Part of the programme was using Flip and Pay standard model, and there's a little bit of information about that there, which includes a series of workshops, resources and education sessions, which was very successful, but we recognised in place from the insight that there were still further opportunities from the programme. And so some of that local adaptation included a recognition that a lot of the work was focused on health professionals and their understanding of chronic pain, but less so on physical activity professionals, who were still often unclear about the relationship between physical activity and pain. So we ran an additional 2-day workshop focused particularly on physical activity professionals to improve their understanding and how physical activity and chronic pain could be integrated. And they also involved people with lived experience of chronic pain. We've also, and this is very experimental and something that we're trialing at the minute, recognised that some of the workshop sessions for communities weren't in accessible locations for our most disadvantaged communities. So at the moment, we're trialing a project of bringing flipping pain into community venues in some of our local communities, particularly around Grangetown, South Bank and East Middlesbrough. So opening up to people who perhaps wouldn't go to, for example, a lecture in a university, but would go into their local trusted community centre. And also how we build flipping pain resources into a new social prescriber scrapbook that we're developing with social prescribers locally, and also trialing a digital offer. And here's a quote from one of the physical activity professionals explaining how the events help them navigate people with chronic pain and help them to change their beliefs around the condition, and that movement and physical activity are possible. For the third example, I thought we'd just move out of a kind of a more clinical arena and describe one of the community projects that we're involved with. And this one's Creating Active Schools, which was a national programme developed initially in Bradford, looking at how we can build physical activity across the school day and not just in PE lessons. So there's a little bit of insight into that. In a piece of work that we did, we put activity bands, Moki bands, on a group of children in a primary school in their PE lesson, and found that in a 1-hour lesson, the children did less than 20 minutes of moderate to vigorous physical activity, whereas the school, of course, was thinking they were doing an hour, demonstrating the need to move beyond PE lessons in terms of building activity in opportunities for children. So it's a whole school approach, working with the leadership team, the students and parents and carers. And the focus of the programme has been very much on building the capacity of the staff, using data-driven insight, particularly the use of activity bands, and ensuring that whatever's done in the school is co-designed with the students themselves. And the partnership that's delivered that locally has included our 2 school sport partnerships in Redcar and Cleveland. Redcar and Eston School Sports Partnership and Cleveland School Sports Partnership, and Tees Valley Sport, our local active partnership. An analysis of 8 schools that have already taken part in the programme, we're now up to 31, but from the first early 8, was that the programme over a year resulted in improvements from 1 to 11 minutes per day per student, with all schools demonstrating positive progress. That may not sound a lot at 11 minutes a day, but that's per student, and that builds up obviously over the year. There's also some issues around when the children first put the Moki bands on, they become more active anyway because they've got the bands on. So the baseline is probably higher than the normal level. But what was particularly important about this programme is that it wasn't just aimed at the children and bringing about the changes in their behaviour. As I mentioned earlier, a lot of our work is around how we work with organisations to change their behaviours and build a value of physical activity. And so these results here are how the programme has impacted upon teacher behaviours and their willingness to build physical activity and their confidence to build physical activity into the school day, and their value of physical activity as part of the work that they're doing. And amongst them, particularly good examples are the confidence in implementing physical activity, which went up by 13% as a result in the programme, and the frequency of conducting active lessons at least once a week. So that's building physical activity into a lesson other than a PE lesson, which rose by 21%. And interestingly, one school reported that at the launch day, the low-level behavioural issues ceased completely once every child became active for at least 20 minutes. So some of the learning from that, the first part is that the programme's success was very much recognising that sustainable change requires comprehensive system transformation. So we could have gone in and just worked with the children on activities, but that's not sustainable. It's really the work with the leadership team and the staff that have brought around the more sustained change. The need for strong leadership, how we've used objective data, so particularly using activity bands to enable us to measure accurately the activity of children, the importance of the child's voice in the process, and an element of ongoing support at a lower level once schools have completed the programme. One of our other pieces of learning, though, was that the initial framework, although it is excellent, was often too detailed for a number of the schools. And so, again, using the flexibility of the programme that we have and the support of Sport England is adapting that model based on local learning to allow schools to take more of a lead themselves using a simpler programme and be more specific about identifying where they need help and support. And a piece of work that you may be interested in, if you're interested in physical activity in children, and particularly around play, which doesn't come from our work but is related, is the Raising the Nation Play Commission report, which is just being published, which is looking at how we create the end of an anti-play culture and encourage children to get away from their digital devices and get out and play more. So that's in today's BBC News, if you want to have a look at that. So to round up then, a little bit about a kind of a summary of the approach that we've used, and that is, we recognise ultimately that behaviour change is around changing the behaviour of individuals, but we need to create a value of physical activity beyond that, so that right through the system, physical activity is valued, often in places where it's not the primary outcome. And that means changing behaviours in organisations as well as individuals. And of course, organisations are made up and not organisms. You don't change their behaviour, but we change the behaviour of the people in them. And taking a systemic approach to change, so digging in deep to address the real issues that create physical inactivity in a particular system or setting, and starting to address those, and recognising that changes using a systemic approach may be more significant, but they do take a long time, and there's a lot of learning in between of things that do and don't work, and the need therefore to hold our nerve. That's everything I wanted to cover. If you do want to know more, you have a look at our website, and also either of those two emails will get you to me. Thank you.
Thanks very much, Mark. I think that has been a really great example of a holistic and collaborative approach to have a real impact when we're driving any improvement. But it's also highlighted the real value in any lessons learned if we want to continuously improve. So great example, great learning there. Does anyone have any questions? There is nothing in the chat right now, but feel free to pop your hand up if you've got any questions or just comments. If you want to chip in, go ahead. I can't see any hands up and there are no questions in the chat, but Mark's details, his contact details are on the screen there right now, so feel free to get in touch with him after the event. And as I said at the beginning, this has been recorded, so you can share it or watch again after. We've got some thank yous in the chat. Great insight into our local area. So thank you for that, Mark. So if we've got no more questions or comments for Mark, just to let you know, we've got some more comments coming in. We have a range of health fact sheets that are free, specific to swimming. Thank you very much for that, Martin. He's posted a link in there if anyone wants to have a look at those and share those too. So if no one has any questions or further comments, just to let you know that the next Lunch and Learn will be on the 2nd of July. The details will get posted in the chat right now. Amy has just popped them in for you. And it is about starting to move on the move. So it's on the 2nd of July, and there is another Lunch and Learn coming up later in July as well, so watch out for that. There is a contact detail on the screen right now, info@boost.org.uk, if you want to get in touch with any ideas or suggestions for any future Lunch and Learns. But if there are no more questions or comments, we will just leave it there. So thank you very much for attending. I hope you found it really useful.